Hi, my name is Jessica. My presentation is on the Substance Abuse and Mental Health Administration, or Samhsa, which is part of the NIH. The Substance Abuse and Mental Health Services Administration's mission is to reduce the impact of substance abuse and mental illness on America's communities. They have a suicide prevention lifeline, a treatment center locator, treatment referral line that are all available 24/7. The three buttons that are on the left-hand side of the screen are shown on the Samhsa homepage, which is also samhsa.gov. In order to achieve the mission of Samhsa, they've identified 8 strategic initiatives to focus on improving the lives of the United States citizens. The initiatives are a prevention of substance abuse and mental illness, trauma and justice, military families, recovery support, health reform, health information technology or HIT, data outcomes and quality, and public support and awareness. More information and resources of all 8 of these initiatives are found on the homepage. Samhsa is further divided into a bunch of centers and offices that help carry out all of the different functions of their mission. The Center for Mental Health Services focuses on the prevention of treatment of mental disorders. The Center for Substance Abuse Prevention's goal is prevention and reduction of abuse of illegal and illicit drugs, as well as alcohol and tobacco. The Center for Substance Abuse Treatment supports the provision of effective substance abuse treatment and also recovery services. The Center for Behavioral Health Statistics and Quality is responsible for the collection, analysis, and the dissemination of behavioral health data to both the public and to health professionals. Since we are in a world of technology, I think it's really cool that a federal organization is utilizing social media to try to reach as many people as possible in as many vessels as possible. These shown here are the main ones that they subscribe to, but anyone that comes to the Samhsa website can also share the stuff that they find to other blog sites, to photo sites, LinkedIn, all sorts of things by clicking on a button in the top right-hand corner. So here you can share things to Facebook, to Twitter, to YouTube. They have their own blog on the website. The orange box is an RSS feed, which is kind of like a newscast feed, so it shows different news stories. And the last one is a Flickr account, which is different photo albums that they have for various campaigns, much like the National Mental Health Awareness Day or Children's Mental Health Awareness Day and things like that. By using all these sites, this way not only does Samhsa get the info out their way, but others can make it viral in their own words, which is pretty cool. This slide is a variety of different campaigns and publications used to support healthy living that you can find on the website. The first one is What a Difference a Friend Makes. You may have seen the commercials on TV. If you haven't, I highly suggest looking them up. You can find them on YouTube. They're really funny. The next one is Too Smart to Start, which is a campaign reaching out to youth and teens, but as well as community leaders and family to prevent underage drinking before it starts, kind of saying that it's not really the cool thing to do. The next one is Tips for Teens, which is a series of brochures put out by Samhsa. I think there's like 11 of them, and they give kind of a myth versus fact way of explaining about various drugs like ecstasy and heroin and marijuana, but also tobacco and alcohol. The last one on the left side is the Blue River Walkway one, which is the Resource Center to Promote Acceptance and Dignity and Social Inclusion, which is a campaign that is about people with mental health problems are people too, and they can live everyday lives just like the rest of us. Kind of basically, like, you may have a best friend that has chronic depression and you wouldn't have even known until they told you, because they can manage just fine like everybody else. It's a social inclusion for communities so that they can live without fear of prejudice and discrimination because of their condition. But it also touches on acceptance in general, which is a big problem, especially in middle schools, because kids are afraid to be who they are because of who they are. The first one on the right side is Getting Through Tough Economic Times, which provides practical advice on how to deal with the effects of financial difficulties, which can be detrimental to your physical and mental health. And the last one is a really cool campaign that's called That's My People. That's My People is a video that was filmed in 2011 at the National Intertribal Youth Summit, which was in Santa Fe, New Mexico. It talks about a lot of the issues that tribal youth all across the nation are having, and they identified as important to address in their communities, and they range from mental health and substance abuse to just family problems and just living in the community on the reservation. I think this slide is really important because it not only addresses mental health and substance abuse issues that might not always be considered at first thought, but also shows that the little things can make a difference, which I believe is one of the basis of public health practice and promotion. These next few slides are things I found on Samhsa, mostly geared towards administrators and who doesn't need funding for their programs. Samhsa has an entire section dedicated just for grants. Samhsa also has a lot of free or low-cost literature available to the public. For example, I did a search for anything that was professional that had to do with administrators, and it came up with 97 and 16 related websites. Listed on the right side are other audiences that I think would be applicable to check out as an administrator for additional resources such as nonprofit or education, things like that. The last two parts of the Samhsa website that I wanted to point out as significant to a person in the health field were the data spotlight and the featured resources, which are both on the homepage. These both change frequently and give updated information through studies and statistics that are relevant topics to today's issues. The Substance Abuse and Mental Health Services Administration is a pretty neat website. There's a lot of information to explore about getting help for yourself or for a loved one or a patient or a friend of this person that commented on your blog last week that lives in New Jersey. There's a whole section that is on different ways to have interventions for all sorts of different kinds of people. So use it. Here are my references, and let me know if anyone would like the links to the videos on the What a Difference Your Friend Makes or to the This Is My People video. You can find them on YouTube, but I have them handy, so it might be easier to find them that way. And thank you.